the basic benefit, as we discussed, of ruxolitinib, which is the JAK inhibitor used for spleen and symptoms, is improving that quality of life, decreasing the organs, and with a massive decrease in the spleen, which is the most important factor for life extension, you get that few years of extra life. This is what we use it for, improving the quality of life, improving the spleen. The smaller the spleen gets, the longer the life is. That is the theme that has been around for many, many years right now. The fedratinib was approved in fall last year, but it is similar to ruxolitinib. I would not expect much different outcomes. We don't have all this information about it because it's new, but I would expect it to follow the same patterns. Now, when should you start the therapy is then a question, right? Now, we know that the side effects of JAK inhibitors is lowering of the blood cell count. We also have some information that possibly very, very big spleens, when you wait for spleen to be humongous, they may not respond as well as the smaller spleen. But the main problem is the suppression of the blood cell count with the JAK inhibitors. They do cause thrombocytopenia and anemia. And if you start therapy when patient is already in advanced phase with low blood cell count, you have difficulty providing optimal dose of JAK inhibitor. So the studies actually showed that earlier intervention, when people are not so sick, do not have such a degree of anemia, do not have so low platelet number, earlier in their life with the disease, make difference. You have a much better control of the spleen, much better. You have less of discontinuations, less of infections, and you can plausibly then prolong life even more, right, with earlier intervention. So this is when we talk about why early and when. When you have symptoms, NCCN guidelines say so clearly. I was participating in the development of our national NCCN guidelines that you don't wait for patients to be in a dying mode. You start early when the patients have a significant problems already, regardless whether the risk of dying is low or high risk. Help the patient, and early intervention pays off long term.